Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is the top 10 ways to avoid the need for a joint replacement. Over 1 million joint replacements are performed annually in the U.S., with hospital stays entailing 2 to 4 days. For knees, the average age is about 70 years, with 60% being women. The infection rate is 1 to 2%. There's also a risk of blood clots. There's 90% satisfaction rates. 85% of artificial knees still work after 20 years. It is not a foolproof procedure. There are some risks associated. These are quality of life procedures. No one has to have a joint replacement. Because the implants don't last forever, it's advisable to wait as long as possible to undergo the replacement. The implants used for procedures are made of titanium, cobalt chrome, stainless steel, ceramic, polyethylene, or combination of the metals. Treatment option number 1, activity avoidance. If it hurts, don't do it, or do it less than before. So for instance, if you're an avid runner and it causes you pain for days on end afterwards due to arthritis, switch to cross training. Start swimming or cycling. If you play golf 6 days a week and it's killing you, cut back to 3-4 days. So activity avoidance. Number 2 is over-the-counter medications. This may include anti-inflammatories such as ibuprofen or naproxen, Tylenol, or glucosamine and chondroitin. Those are available in any health food store. Very, very low risk and can be very helpful. Treatment option number 3 would be prescription medications. This may include topical prescription pain creams, higher dose anti-inflammatories that you can't get in the store, Celebrex for those who have GI upset, and then short-term opiates for exacerbations. You shouldn't do long-term opiates for arthritis. Treatment option number 4 includes TENS units. These are battery-powered devices that you see here about the size of an iPod. They have foam sticky pads that go on the skin over the joint area of arthritis. Provides a low-dose electrical stimulation through the skin, and it can change the way the brain perceives pain signals and make it better. Treatment option number 5 is weight loss. Less joint stress means less potential damage to weight-bearing joints. Losing weight with exercise and diet may strengthen up the muscles around the arthritic joint, lessening pain. There are several studies, old and new, that show that less weight across joints is going to decrease the amount of pain. Treatment number 6 option is physical therapy. It's well known that strengthening muscles around the joints can take pressure off of the arthritic joint for pain relief. Modalities may include ultrasound and electrical stimulation, and stretching is crucial for pain relief as well. Option number 7 is acupuncture. Several studies have looked at acupuncture for arthritic joints, and time again it shows a statistically significant benefit to pretty much every joint it's been looked at. Okay, so it's a very, very, very low risk procedure, and it can be very helpful for relief. Treatment option number 8 is steroid injections. It's never been proven that steroids damage joint cartilage. They showed that in small animal studies. When they looked at large animals, though, it actually didn't occur, and they've never shown it in humans. So they have stood the test of time for decades. They're typically given every 3 months as needed, and they really don't alter the disease state at all. They can just provide excellent Band-Aid for pain relief. Treatment option number 9 is hyaluronic acid injections. These are made from rooster combs. Our joints all contain significant hyaluronic acid naturally. It's like the motor oil of your joints. So the theory behind these injections is that it can provide hyaluronic acid for pain relief, and it also promotes the formation of cartilage. We don't know that for a fact, but that's what we think is happening. Studies show 65 to 75% good to excellent results for 6 to 12 months. So they have stood the test of time, and they're reimbursed by insurance. Treatment option number 10 is the newest, most cutting-edge options, which are regenerative medicine injections. This includes PRP therapy, which is platelet-rich plasma therapy, and then stem cell injections, either bone marrow or fat or amniotic-derived. These are here, they are now, they are being used on patients successfully, and they work very well. We don't have large studies to show their benefit, but we have plenty of small studies to show they can be beneficial for not only pain relief, but for helping patients avoid the need for joint replacement. So most patients are able to delay or avoid the need for joint replacement with some of these or all of these 10 options. While most joint replacements do end up fine, there's always a chance of complications, and it is truly a quality of life procedures. Knee injections, for instance, have over 75% good to excellent results. The top non-operative pain management in Texas is through the Texas Pain Network. There are several affiliated clinics throughout the state, accepting over 50 insurances and providing over 25 treatment options with success rates exceeding 90% with the board-certified award-winning doctors. Visit us online today at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.